I was telling you about that sleep study I needed?
Yeah.
Well, getting my insurance to agree to it, that was a whole thing.
Uh-oh.
Yeah, they called it like a prior authorization.
Ah, yeah.
Honestly, the whole process was a nightmare.
I feel that. It's one of those, you don't even know it exists until you suddenly need, like, a medical procedure or something.
And from what I've heard, it's a really big deal in orthopedics, right?
Totally. We were looking at some research on that, and yeah, it seems like a huge pain point
Mm.
for everyone involved.
So today's deep dive is all about prior authorizations in orthopedics. We've got a ton of research to dig into, and hopefully by the end of this, we'll all understand a little better what's going on.
Sounds good to me.
Okay, so before we go any further, can you give us a quick rundown on what a prior authorization actually is?
Basically, it's like your insurance company hitting the brakes before they'll agree to pay for certain treatments or procedures.
So it's like they need to give their permission first.
Exactly. They want to make sure that whatever you're getting done is, actually necessary.
And that makes sense in theory, but how does that actually play out when it comes to orthopedic care?
Well, the research we're looking at today really highlights how this impacts both patients and the orthopedic specialists.
And this DataMatrix article you sent over, that's the one that really digs into the details, right?
Yeah, exactly. They did a deep dive into the whole prior authorization process, and it sounds like it can be a huge headache for everyone involved.
So let's talk about those headaches. What are some of the biggest challenges that came up in your research?
Well, one of the things that really jumped out was just how much time this whole process takes up. Like, the article mentioned doctors and their staff spending an average of 14.6 hours per week just dealing with these prior authorizations.
Wait, 14.6 hours? Seriously?
Yeah.
That's insane. No wonder everyone's so frustrated.
Right. And think about it, that's time that they could be spending with patients, actually doing what they went to medical school for.
Okay, so that's a lot of time, but what are they actually doing during those 14 hours? What does this process actually involve?
Oh man, where do I even start? Phone calls, paperwork, faxes. It's like stepping back in time.
And I've even heard of this thing called a letter of medical necessity.
Oh yeah. You're telling me you had to get one of those?
Thankfully, not personally, but a friend of mine went through it, and it sounded like a nightmare. Basically, the insurance company wanted her to justify why she needed surgery.
It's true. They basically want your doctor to make a case for why this procedure is medically necessary. And it can't just be some quick email either. We're talking like a full-on detailed letter citing medical evidence and everything.
So not only are you dealing with the stress of needing surgery, but then you have to jump through all these hoops just to get your insurance to agree to it.
Exactly.
Ugh, it's like they don't trust doctors to know what's best for their patients.
It can feel that way sometimes. And the worst part, even after all that, there's still no guarantee the insurance company will approve it.
You're kidding. So you could spend hours and hours on this paperwork and it might not even matter.
Yep. Welcome to the world of prior authorizations.
This is sounding more and more like a bureaucratic nightmare, not a healthcare system.
Tell me about it. And it gets even more complicated because each insurance company has its own specific requirements. Different forms, different processes.
Oh, so not only do doctors need to be experts in medicine, but they also need to be experts in insurance policies.
Pretty much.
Hmm?
The DataMatrix article called it out. A lot of orthopedic surgeons are feeling burnt out. They feel like they're drowning in administrative work. They just want to treat their patients.
Yeah, right. That makes total sense. So we're seeing how this prior authorization thing can directly impact the doctors. But what about the patients themselves? What kind of effect is this having on them?
Well, one of the biggest issues is treatment delays.
Delays. Like how long are we talking?
The DataMatrix article mentioned cases where patients had to wait weeks, sometimes even months, to get essential procedures done. We're talking things like knee replacements, spine surgeries.
Oh my gosh, that's awful. I can't imagine having to put my life on hold like that, especially when you're in pain and you just want to get better.
Oh, yeah. It's a really tough situation.
Yeah.
And it's not just the delay itself. Think about the impact this has on someone's quality of life. They're in pain, they can't move around easily. It can really take a toll.
It's like their whole life is on hold while they wait for the insurance company to give them the green light.
Exactly. And speaking of waiting, the article brought up another concerning point, the reliance on pain management while people are waiting for these procedures.
That makes sense. I mean, if you're in pain and you're waiting for surgery, you're going to need something to manage it.
Exactly. And that often means patients are put on strong painkillers, sometimes for long periods of time.
And that comes with its own set of risks and side effects.
Right. So it's like this vicious cycle. The prior authorization is supposed to be about controlling costs and preventing unnecessary procedures.
But then those delays end up leading to other problems, potentially even increasing healthcare costs in the long run.
Exactly. And, it's not all doom and gloom. The DataMatrix article actually talked about some potential solutions.
Oh, really? Look away.
Well, one thing they highlighted was the rise of these third-party services that are popping up to help navigate the whole prior authorization process.
Interesting. So they're like the middlemen between the doctors and the insurance companies.
Yeah,
And
exactly.
they just handle everything, all the paperwork and the phone calls and all that.
Pretty much.
So these third-party services, are they kind of like prior authorization specialists, taking on all the hard work so the doctors don't have to?
Yeah, exactly. Like, they'll handle all the paperwork, make sure it's all filled out right, and they'll even deal with the insurance companies directly.
That honestly sounds like a lifesaver, especially for like smaller orthopedic practices. I mean, they probably don't have the staff or the resources to deal with all of that on top of everything else.
That's exactly what the DataMatrix article was saying. A lot of these orthopedic surgeons just don't have the bandwidth to handle it all.
It just makes you wonder, why isn't this the standard? I mean, it seems like if these services are out there saving everyone time and money and headaches, shouldn't it just be, how things are done?
Well, that's a good question. Like with a lot of things in healthcare, it often comes down to awareness. A lot of doctors might not even know these services exist.
Oh, that's a good point. And even if they do know, I imagine cost is a factor too.
Definitely. Someone's got to pay for those services, right? I think some insurance companies are starting to see the value, though.
Oh, really? So they're actually willing to cover the cost of these third-party services?
Sometimes. It really depends. Some insurers are realizing that it can actually save them money in the long run. Like if it means things get processed faster and they can avoid like even more expensive treatments later down the line.
Right, that makes sense.
But
Yeah.
it's still a bit of a mixed bag.
Okay, so it sounds like these services are a step in the right direction, but maybe not a perfect solution just yet. But what about us as patients? Is there anything we can do to navigate this whole prior authorization thing?
Well, first and foremost, knowledge is power. The more you understand about your insurance plan, the better off you'll be.
Yeah, that's easier said than done. Have you ever seen the paperwork they send you? It's like reading a foreign language.
Oh, tell me about it. It can be totally overwhelming, but trust me, it's worth taking the time to at least familiarize yourself with the basics.
Basics, like what?
Like, what are your coverage limits? What's your deductible? Are there different tiers of authorization for different types of procedures? Things like that.
So basically, don't be afraid to ask questions.
Exactly. Call up your insurance provider, get them on the phone, have them walk you through your plan step by step. Don't let them off the hook.
And I guess the same goes for your doctor's office too, right?
Oh, absolutely. Your doctor and their staff can be invaluable resources too.
Especially the administrative staff, right? They're the ones dealing with insurance companies all day, every day.
Exactly. They've
Yeah.
seen it all. They can help you get all the right documentation, make sure everything's in order, and they can often help advocate for you too if there are any issues.
Okay, so I'm feeling a little more empowered already, just knowing what questions to ask and who to ask them to. But with all this talk about technology and healthcare these days, is there any hope that this whole prior authorization process might, I don't know, become more streamlined in the future?
That's the million-dollar question, isn't it?
Yeah.
And the good news is there are people working on it. Like, imagine a world where you don't have to deal with all these forms and phone calls.
Instead of all that, it's all digital. Like your doctor just submits everything electronically and you get an answer right away.
Exactly. And it's not just about speed either. It's about accuracy too.
Oh, yeah, for sure.
I mean, a lot of these delays happen because information is missing, or there are errors in the paperwork.
Ugh, tell me about it. I once had a claim denied because, get this, I put one wrong number in my insurance ID.
Oh, no.
One digit out of like 20?
It happens. But yeah, with these electronic systems, there's a lot less room for that kind of human error.
Right.
Plus, a lot of times, they can actually flag potential problems before the request is even submitted.
Okay, that is what I call progress. It's like, back in the day when we used to mail handwritten letters,
Yeah.
and then email came along and changed everything.
Totally.
It's like that.
It's a complete game changer. And some hospitals are already using these electronic systems too.
They are.
Yeah. And they're seeing some really positive results, like things are more efficient and patients are happier.
Well, that's great news. It sounds like this is something that could really transform healthcare as we know it.
I think so too. And the potential is really exciting.
Yeah.
I mean, imagine systems that could automatically check your benefits for you,
Okay.
or even like predict how likely it is that your prior authorization will be approved.
Wow, that would be amazing. No more last-minute surprises or anything. Patients could really be in the driver's seat when it comes to their healthcare.
Exactly. And that's really what it's all about, right?
Yeah.
Empowering patients and providers to work together without all the administrative headaches.
Couldn't agree more. Well, this deep dive has been incredibly eye-opening. I feel like I've learned a lot about prior authorization, even just in the last hour.
Me too.
It can definitely be a frustrating and confusing process.
For sure.
Hmm.
But like we were saying, knowledge is power.
Mm.
And the more we understand about it, the better we can advocate for ourselves.
Absolutely. And hopefully, as technology continues to advance, the whole thing will become a lot smoother and less stressful for everyone involved.
Fingers crossed.
Well, on that note, I think we're about out of time for today's deep dive.
This is great.
It was a pleasure chatting with you, as always.
Likewise.
And to all of our listeners, thanks for joining us. We'll see you next time for another deep dive.